Hello, I am Dr. Basanth Kumar, consultant nephrologist at Amrita Super Speciality Hospital and People Tree Hospital, Bangalore. Today I will be discussing about pedal edema, its causes, symptoms and treatment. Edema by definition it is called accumulation of the fluid in the body parts. It could be either single limb or it could be generalized. So, before coming to the causes for pedal edema, we need to know what is edema, how to diagnose edema and what are the symptoms the patient with pedal edema will present it. So, edema can occur in a single limb or it can occur over the whole body. So, the several causes for edema are, one is simple dependent edema, so which occurs when we stand for prolonged periods or sitting for prolonged periods. So, there will be pulling of the blood in the both lower limbs, that will cause edema. So, leakage of fluid from the body blood compartment into the interstitial compartment. So, the next most common cause is it could be single edema due to clotting of the blood in the veins. Blood clot in the veins in the lower limbs, that is called deep vein thrombosis. So, that can cause accumulation of the fluid, blood in the pulling of the blood in the lower limb, that will cause edema due to leakage of the fluid into the interstitial compartment. So, the another most common cause which we see in day to day common practice is varicose veins. So, varicose vein is nothing but dilatation of the blood vessels in the both the lower limbs. So, once a patient with some occupation like drivers or pilots who sit for prolonged periods or police who stand for prolonged periods, so they develop pulling of the blood in the lower limbs, that will cause edema. Other most common causes are nutritional. So, one of the most common cause which we say in day to day practice, it could be nutritional. So, if there is poor nutrition intake, so the albumin levels will be low and the low albumin levels will cause low oncotic pressure and that will cause leakage of the fluid from the blood compartment into the interstitial compartment. So, when the edema is bilateral and it is severe, so it is generalized, then we need to think of some systemic causes. Whenever a patient presents with bilateral edema and generalized edema, so we need to evaluate what is the cause for the edema and then treat accordingly. So, there are several systemic causes which can cause edema. One of the most common causes which we see in our day to day practice is kidney failure. So, patients with kidney failure or renal failure, they will present with edema that can be or that will develop over the lower limbs and it will progress. Once it is generalized, the patient will develop symptoms of breathlessness and orthopnea. So, as a result, patient will not be able to lie down. So, kidney failure, normally we know that kidneys will filter the blood and they will remove excess water accumulated in the body. So, once the kidney fails, so it will not be able to excrete the water load and hence there will be more fluid accumulation in the body, that will lead to edema and breathlessness. The other most common cause which we see in our day to day practice is cardiac failure. They will present with edema due to poor pumping of the heart and also back pressure. So, that will be manifested over the lower limbs and once it is severe, it can be generalized also. The third most common cause, another most common cause which we see is liver failure, particularly cirrhosis of the liver, where the edema will be more prominent in the abdomen. So, the fluid will be more accumulation will be more in the abdomen. Once after that, it will also involve the lower limbs and it will be generalized. So, or it could be due to several other causes. Pregnancy can cause compression of the blood vessels and it can also cause edema, that could be physiological also. And patients with pregnancy who have raised blood pressures, they can also develop so pedal edema due to the proteinuria. Preeclampsia can cause proteinuria and they will also develop edema. So, other than this, we need to rule out some gastrointestinal disorders like protein losing enteropathy, which can also cause edema because of the decreased absorption of the proteins from the gut. So, coming to symptoms, how the patient with edema will present. So, they will complain of tightness of the legs or shiny legs, or they will might present with in patients with varicose veins, they will develop discoloration of the lower limbs and also pitting edema. So, how to diagnose it? So, once you press over the lower part of the leg, so on the medial side, so there will be pitting. So, pitting suggests that there is edema. Some patients with renal failure particularly, they will complain of puffiness of the face. So, they will early morning, whenever they get up in the morning, they will complain of puffiness of the face, swelling of the face. So, that is one of the most common symptoms in patients with renal failure. Cardiac failure patients presently predominantly presents with edema of the lower limbs, for both lower limbs will be the most common presentation. Liver failure patient, they will present predominantly with edema in the abdomen, and then fluid accumulation in the abdomen, and also then they will manifest fluid in the lower limbs. So, edema, whenever a patient presents with edema, so we need to rule out if there is any systemic condition involved, because simply treating with low salt diet and diuretics will not help in all the cases. So, unless we identify the basic cause of the edema, then it will be difficult to treat the patient. So, coming to the treatment aspect of the patients with pedal edema. So, there are several treatment. Dependent edema, which is commonly seen, it could be due to prolonged standing or sitting for prolonged periods. So, usually in these patients, so if they will lie down and sleep and get up in the morning, so the edema will settle. Or in patients, we can ask the patient to elevate the limbs at night. So, that will also relieve the edema. Particularly in patients with varicose vein, so if it is due to the venous pulling of the blood in the lower limbs, so we can ask them to use crepe bandages, or we can ask them to use elastic compressive stockings. So, and in patients with DVT, if it is unilateral edema, so then we need to treat the deep vein thrombosis and look at the cause, basic cause for DVT, and then treat it with anticoagulants. So, other causes, whenever there is bilateral edema, systemic disease involved, then we need to diagnose with particular test to look at what is the basic cause, then treat accordingly. So, the main part of treatment of any patients with systemic edema particularly involves decreasing the salt in the diet. So, we need to advise all patients with any edema to decrease the salt intake. So, and also the water intake has to be restricted. So, fluid intake has to be restricted, salt intake has to be restricted. So, to increase the urine output, so how to relieve the edema is we need to give some diuretics tablets for relieving edema, particularly furosemide or torsemide, which are available. So, and in these drugs when given, they will increase the urine output and will cause more urine to be passed, so that they will lose weight and also the edema decreases. Patients with renal failure, we need to use diuretics, particularly they play a very important key role in management of edema in patients with renal failure. So, either furosemide or torsemide can be used in patients with renal failure. Associated with the patient has to decrease the salt and water intake. Patients with cardiac failure, we need to same thing as for renal failure patients, low salt diet and also decrease the fluid intake. Diuretics play an important role. Other afterload reducing agents and the drugs which improve the cardiac function. So, pumping that has to be added for the treatment part of edema. Patients with particularly with cirrhosis of the liver, that is liver failure patients. So, the drugs of choice in this patient is also diuretics plus a potassium sparing diuretic. So, there are two groups of diuretics which can be used in these patients associated with low salt diet, and also the fluid intake has to be restricted. So, varicose vein patients, as I said previously, so use of simple compressive stockings can be helpful, and in patients with DVT, so treatment with anticoagulants can also relieve edema. Another important cause which I mentioned, that is protein losing enteropathies or due to malabsorption. So, these disorders has to be diagnosed and then treated with supplements with high protein diets which get absorbed, that is also important. And in patients with there is another cause which is lymphatic disorders. So, if there is problem with the lymphatics which drain the interstitial fluid, so that can cause lymphedema, and that can also be relieved with some surgeries or other things. So, but the main thing is in lymphatic edema it will be unilateral. So, we need to diagnose causes for edema in all the patients. So, once we diagnose the basic cause for edema, and also the then if we treat the basic disease, the edema will get resolved. So, whenever a patient with renal failure or any other systemic disease presents with edema, we need to consult a physician, so that they will look at what is the basic cause and diagnose the basic cause and then treat accordingly. If particularly if he has a renal disease, they have to refer to a nephrologist. If he is having a cardiac disease, cardiologist, and any liver failure patient has to consult a hepatologist or anything. So, but the mainstay of treatment for any patients with edema is to decrease the salt intake, to decrease the fluid intake, and also the diuretics, which are the main drugs of choice. They play an important role in treatment of patients with edema. Thank you.